I think all of us are seeing research emerging about the vagus nerve and vagus nerve stimulation, and it's really compelling. And we know that you've had a long career helping patients to address chronic pain. So, to get us started today, I thought it would be helpful to learn a little bit about how you got involved in this type of work and vagus nerve research specifically.
Well, thanks for asking. I mean, I got started many, many years ago when I started the Division of Pain Medicine at Johns Hopkins University. And I was particularly interested in how electricity can help control pain. And I
Mm.
became the first anesthesiologist with surgical privileges to implant devices, peripheral nerve stimulators and spinal cord stimulators, for management of pain and mobility disorders. And that was a very, very long time ago. And over time, my interests have morphed from just peripheral nerve stimulation and spinal cord stimulation to taking a look at the other big nerve, which is the vagus nerve. Uh, my history is actually quite personal. I had been president of the Neuromodulation Society and had learned a lot about how we could use electricity to improve dilation of the coronary blood vessels in cases of angina. When I learned that my son had peanut allergies, at that time, it wasn't really known what the innervation of the lung was, and we went to work trying to figure out how to bronchodilate somebody if they are in a state of anaphylaxis or airway reactivity. We figured it out, and it turns out that it's the vagus has a lot of control over the lungs. So this started with a very basic scientific project, uh, which had its roots in a very personal story for me.
I can see why you'd be highly motivated to
Yeah,
do this type
yeah.
of work. For those who maybe it's been a while since they were in anatomy and physiology class, will you just do a quick overview of the vagus nerve and talk to us about how it contributes to our parasympathetic nervous system?
Sure. So I'm going to step back a little bit and just describe where this sits into the whole nervous
Yes,
system.
please.
Your body really has three nervous systems. It's got the somatic nervous system, and that allows you to interact with the outside world, to touch, to feel temperature, to feel uh, the desk that you're sitting at, to be able to walk, to ambulate. That is the somatic nervous system. There's two other nervous systems. One is the enteric nervous system, and some of your listeners will know about the enteric nervous system, and that's the nervous system that kind of covers the gut. And then there is the autonomic nervous system, which is largely made up of two branches, the sympathetic and the parasympathetic. Now, everybody's heard of the sympathetic nervous system, the fight or flight nerve. But what's less appreciated is that there is a parasympathetic, a counterbalance to the sympathetic nervous system. And that counterbalance is the rest, relax, and recovery. This nervous system is so critically important in many physiological functions, from your cognition to your gastrointestinal tract. It really controls the internal workings of your body. And until recently, we've not really known how to tap into it. I would say, in fairness, there were people 4,000 years ago who had kind of started to suggest this with acupuncture and other therapies like that that probably tap into the vagus in part. But modern medicine has refigured this out since the late 1990s.
Mm. I remember being in school and working with our cadavers and learning about the vagus nerve as the wandering nerve. Will you
Yeah.
tell us a little bit, why is it called that?
So the vagus nerve is the only cranial nerve that leaves the head and the skull area. It drops through the jugular foramen, comes down through the carotid sheath. It then spreads out and controls lung function and cardiac function, continues to drop down on the inside of the chest and pop through the diaphragm. And then, like a spider web, it just spreads out over all of the visceral structures in the gastrointestinal tract. So this would include GI motility, the pancreas, control of insulin, etc. And so there are so many structures that this nervous system is controlling. About 80% of the nerve fibers that come back, send signals to the brain about what's the status of the organism, from are you hungry to there's infection going on. And it sends information back up. And what's been recognized recently is that the brain then says, aha, there may be issues here. Let's control and let's alter the function of the organs with 20% of the information coming back down. And so that cycle, that information coming in and going out, is almost all controlled by the vagus nerve.
Okay, so we're starting to put this puzzle together of why the vagus nerve might be implicated in conditions like IBS, but then also depression and PTSD
Yeah.
and immune function and allergic response and bronchodilation.
Yes. It is the command and control of so many things that we just take for granted. But it is critically important in many, many different functions. And I think this is one of the reasons the functional medicine community wants to embrace this. I've started thinking about this a little bit differently lately. You know, I consider the human body an electrical chemical organ. And many of the things that we've been doing over the last 100 years, well, I'll say 1,000 years, honestly, has been providing drugs to control receptors or modulate receptors to control symptoms and sometimes control diseases. But that really is only part of the story. Another very important part of the story is the electrical side. The electrical side is every bit as important as the chemical side, but it's not received the attention that it needs. And that's really where a lot of my research has been over the last 20, 30 years.
Hmm. When you 30 years ago started doing this work and you found all these connecting points between body systems, have you been surprised by all of the processes or um, disease states that the vagus nerve might be related to?
Well, definitely. I mean, when I got started, I was very simplistic in my approach and looking at the the lungs. But then when we were treating patients with asthma as part of our original studies, some of the patients reported that my headache went away. So we then went off and studied headaches, and we spent an enormous amount of effort studying headaches with several thousand people in clinical trials on headaches. But, full circle, COVID hit, and I knew that we could modulate cytokines, and I knew that we could bronchodilate. So we got the first emergency use authorization for acute treatment with COVID because there was really nothing else that was out there at the time. So um, the research has taken us into post-traumatic stress disorder, to airway reactivity, treatment of diabetes and obesity and gastrointestinal motility disorders. So it really has been very, very broad. One area that I found interesting is that we are missing the boat on our diagnosis quite frequently. And that's something I think the IFM team can in particularly appreciate, that we tend to be splitters in this world. If you come to see me with anxiety, I'll send you to the psychiatrist. If you see me with depression, we'll go off to the psychiatrist. If you have migraines, you go to see the neurologist. If you have fibromyalgia, you go to the rheumatologist. And nobody really stops to think, okay, what's the root cause here? What's causing all of these problems in patients with multi-morbidity disorders? And maybe about 10 years or so ago, I did two sets of studies looking at a statistical analysis of patients with multi-morbidity, and found that there is, in fact, a latent causation for these different problems. What does that mean? Patients who have multiple different problems don't have a migraine that causes depression or vice versa. There's something that is underpinning these sets of symptoms, from fibromyalgia to anxiety to sleep disorders. And I've called that Vagus Insufficiency Syndrome. And you can see clues of that in long COVID, but we've known about these problems. We've just not labeled it as such. We've just called them patients crazy. But in fact, I think there's an electrical problem. I think there's a problem with the vagus in many of these patients. And if you reflect back, many of the patients had had a viral infection that happened predating their symptoms. Other people have had an automobile injury or some type of fall that could have damaged the vagus nerve. And I think we're on the cusp of understanding that there is a new diagnosis out there called vagus insufficiency. So I challenge your audience here, go take a look at the most complicated patients that you see, the patients with anxiety, depression, migraines, gastrointestinal problems, maybe asthma. You take a look at these really complicated problems and see if you can't track it back to a possible damage to the vagus. And one study that we did was a very simple study, took patients with migraines plus, and we treated them with vagus nerve stimulation. And not only did the migraines improve, but the secondary symptoms seemed to go away. The secondary consults started to go away. The imaging studies started to not be needed anymore. So we have a lot more work to do on this, but this is an area why how you think about things will reflect what you actually see.